helpful are these types of nutrition labels? Do they tell you how much fat or sodium or sugar you're consuming? Do you think they help you make better choices about what you're eating? And what if those labels instead looked like this and were on the front of all packages? Well, that's one of the policy ideas that may be front and center at an upcoming White House conference on hunger, nutrition, and health. Several nutrition advocate organizations have been petitioning the FDA to use its authority to establish a simple, standardized, and mandatory front of package labeling system for all packaged foods sold in the U.S. They believe the widespread availability, affordability, and marketing of these processed and ultra-processed foods and drinks have led to poor diets that lead to increased cases of obesity, diabetes, high blood pressure, and chronic diseases. They say it's happening because consumers don't have time when they're at the grocery store to be detectives and search for the label on a package and figure this stuff out. They believe the United States should make labels really simple and clear on the front of the package like they do in several other countries. For example, you can see this label uses a traffic light concept, so red indicates there's a high amount of sugar, yellow indicates there's a medium amount of fat, and green indicates this is low in salt. Some countries even have Nutri-Scores that grade and color codes foods from A to E. Just so you know, the nutrition facts labels that we know to this day weren't always around. In fact, they didn't even start to be mandatory on packaging until 1994, after Congress passed a law to help consumers understand what they were eating and help them make better, healthier food choices. The requirements for those labels have been revised several times, but now advocates say it's time for another change. Of course, the food industry completely disagrees and said there is insufficient real-world evidence to show front-of-package labels would even influence consumer behavior. And they also believe the FDA doesn't have the authority to mandate front-of-package labeling because, in their view, it's a First Amendment violation because they see it as forced speech. The FDA says it's currently studying how front-of-package labeling is working in other countries, but hasn't made a decision for our country just yet.